Hi, my name is Gaelen. I'm a registered nurse. I can assure you that medical terminology is closely related to A&P, as well as many of the other subjects that you'll encounter as you progress through your nursing studies, and especially as you prepare for your nursing entrance exams. So what do I mean by that? Well, an understanding of medical terminology can really enhance your understanding of these other topics. For example, you can have a better grasp on which part of an organ or which part of the body a word refers to and its specific function. You can understand what a doctor or a certain specialist focuses on, specializes in, and why a patient would be going to see them. You can understand what a specific procedure is for. And so medical terminology is really interwoven with these other subjects, very closely related to them, and there's a lot of value in taking some time to understand medical terminology and to learn how to acquire this type of vocabulary as you progress through your studies. So I'm going to give you some tools and tips for how to do that as you prepare for your exams. What we're not going to do is provide you with a comprehensive list of all the terms that you need to know. Instead, what I'm hoping to do is equip you to be able to learn what words mean as you encounter them in the content that you're reading and studying. Let's talk about how this PowerPoint presentation is going to be broken down today. So we're going to learn how to break down words into their basic parts, specifically root words, prefixes, and suffixes. And if you don't know what any of those mean, don't worry, we'll have definitions here in a second. But being able to break down a word into its different parts can help us discern its meaning, even if we're not able to stop and look that word up. For example, when you're taking an exam, you're not able to Google words that you don't know. So this is a valuable tool for helping you correctly guess at the meaning of a word that you don't know. In addition, we're going to learn how to use the context surrounding a word that we don't know to correctly guess its meaning. So the other words in a sentence, the other sentences in a paragraph, that type of thing. And kind of interwoven throughout those two, learning how to do those two things, we're going to cover some common terms that you'll see in anatomy and physiology and in other topics that you're going to study in preparation for your nursing entrance exams. So we'll throw in some common medical terminology and kind of learn those terms as we're doing these other things. All right, so we'll start with breaking a word down into its individual parts. So root words are the most basic parts of words. If you're thinking about a house, what is the essential component of the house? It's the foundation. Without a foundation, it doesn't really matter what you put on top of the house. It's not going to last. It's not going to be sturdy enough to withstand the elements. It's going to end up collapsing. And so the foundation is the most important part of the house. Similarly, root words are the most important basic parts of words. They are what you build the rest of the word off of. In the English language, many of our root words are derived from Latin or Greek, but some do come from other languages as well. English is kind of a hodgepodge of borrowing from many different languages. And so you do see some root words from other languages as well. So you can add beginnings, which are prefixes, to root words, and you can also add endings or suffixes to root words. And these will change their meaning. To kind of get at what the root word is, we simply remove the prefix and or the suffix, and what we're left with is the root or core of that word. Sometimes root words can be standalone words. So this means that by themselves, they are meaningful words in the English language, which can be used in sentences. Here are some good examples. Dress, which means clothing. Form, which means shape. Normal, which means typical. Phobia, a fear of. And then port, which means to carry. So these words have meaning in and of themselves, but they can also be used meaningfully in sentences in our communication. Many root words, however, are not standalone words. So by themselves, they are not complete. They can't be used meaningfully in a sentence. They still have meaning, and they still make up the core of words along with the prefixes and the suffixes, but they need a prefix and or a suffix to be able to be used meaningfully in a sentence. So here are some examples that we would see in medical terminology. So the root word fract or rupt. You've never heard that used in a sentence because it's an incomplete word, but it means to break. And an example of a meaningful word that is obtained by attaching a suffix to these root words would be fracture, as in a bone fracture, or rupture, as in a ruptured blood vessel. Root word therm, the meaning means heat. And an example of a meaningful word that is obtained by combining a suffix with that root word is thermometer, something that we use to measure temperature, right? And then a final example, the root word ped, it means foot. And an example would be pedal, as in pedal pulses. So pulses obtained by detecting the arteries in and around the foot or ankle, or pedal edema, which is swelling of the lower extremities, such as you would see in the ankles or in the feet. So you can see how that relates to the meaning of our root word here, but it does not become a meaningful word that we're able to use unless we attach a suffix to it. All right, so we said that prefixes are a group of letters attached to the beginning of a root word. And just like root words, prefixes have meaning on their own. So here we have some common examples. Hydro means water. You attach it to a root word and you get hydrate, which means to cause to absorb water. The prefix sub means under or below. Attach it to these root words, cutaneous and lingual, and you get subcutaneous and sublingual. Subcutaneous meaning under the skin, sublingual meaning under the tongue. And then finally, the prefix trans meaning across. An example is transdermal. This word means to move something across the skin. So just a note here, if you add prefixes to root words, the result is a new word with a different meaning. So it relates to the meaning of the root word, but it makes a new word with a little bit of a different meaning. Suffixes are the letters that are added to the end of a root word. And just like root words and prefixes, suffixes have their own meanings as well. Here's some examples. The suffix ic means having characteristics of. So you could say that someone is psychotic, and that means that they, this means of, relating to, or marked by psychosis. So having characteristics of psychosis. The suffix ist indicates a person who practices. So a psychologist would be someone who practices psychology. The suffix logi means the study of. So psychology would be the study of the human mind and its functions, especially those that affect behavior in a given situation. So just like with the prefixes, adding a suffix to a root word can create a new word with a different meaning, related to that of the original root word, but a different and unique meaning and word. And here we have some examples of that. Audiology, the study of hearing. Formless, without a clear shape. Portable, able to be carried. And normality, the condition of being normal. So again, you can see how those suffixes, the new words that they help form, relate to the original definition of the root word, but they still create new words with new, unique meanings. So putting it all together, knowing the meanings of common root words, prefixes, and suffixes can help you determine the meaning of unknown words. So by breaking an unknown word down into its individual components, you can get a good sense of its definition. So let's look at the word transportation. If we break this word down, we end up with the prefix trans, meaning across. the root port, meaning carry, and the suffix chen, meaning act or process. So putting all those individual meanings back together again, what we would end up with is a definition that's very close to what transportation actually means, the act or process of carrying something across. So being able to break that word down into its parts helps us correctly guess at its meaning. Before we start with our first practice question, let me remind you that prepping for your upcoming HESI exam is easier when you use the HESI online course. Get more than just practice questions with the online course. This course is guaranteed to help you pass so you can get into your dream program. Check it out using the links below or head over to www.smarteditionacademy.com. So let's go through some practice questions now to help kind of reinforce these concepts. What is another word for hematologic? Is it A, cardiologic? Is it B, hemorrhagic? Is it C, dermatologic? Or is it D, neurologic? And the best answer out of these options is option B, hemorrhagic. So hematologic, if we break this word down, it's very closely related to the word hematology, which means the study of blood and blood-forming tissues. So the first part of this word, heme, that refers to blood. Logic refers to the study of. It can also mean relating to. So this word means of or relating to blood or blood-forming tissues. As I said, very closely related to the word hematology. Similarly, the word hemorrhagic has that same root word, heme, meaning blood, but the other root word attached to it. So sometimes there are two root words that make up a word instead of a root word plus a prefix plus a suffix, and that's the case here. So this additional root word here at the end means burst. So hemorrhagic refers to an escape of blood from a ruptured vessel or bleeding. So they're both referring to blood or bleeding, and this is what makes this our best answer out of these options. Cardiologic refers to the heart, dermatologic refers to the skin, neurologic refers to the nervous system. So you would hear the word hematologic often related to oncology, actually. Several oncologists specialize in hematology as well. Oncology is the study of tumors, of cancer, and then hematology, as we said, is the study of blood and blood-forming tissues. So there's a lot of overlap in these two disciplines, and so that's why you might see doctors who specialize in both. Hemorrhagic, you might hear that term associated with fevers. A common example is Ebola. Ebola is what is considered a hemorrhagic fever, so a fever that causes bleeding as one of its symptoms. So those are just some common contexts that you might hear those words in the medical field. All right, what is another word for occluded? Is it A, blocked? Is it B, illuminated? Is it C, restricted? Or is it D, enlarged? And the correct answer is option A. Blocked is a good synonym for the word occluded. So the word occluded derives from a root word that means to shut up. So what it means is something that is stopped up, closed up, or obstructed. Similarly, the word blocked can mean obstructed or congested. So both of them carry this connotation of obstruction, of things not being able to move through where they would regularly be able to move through. And you hear the word occluded a lot in medicine in reference to blood vessels. You'll hear about blood vessel occlusion. For example, if a patient has had a heart attack and is in need of some kind of intervention, like the placing of stents, you might hear the doctor talk about the percentage of blood vessel occlusion. This coronary artery was completely occluded. This coronary artery was 50% occluded, so on and so forth. So that's a common context for this word. Let's examine our other options here, just to make sure that we really do have the correct answer. That's a good practice to get into to make sure that you're not missing a better answer. So the word illuminated means to help clarify, to explain, to shed light on. Restricted means limited or confined, so maybe similar to occluded and blocked, but not quite as serious, doesn't have the same serious connotations as these other words, so not as good of an answer. So we're going to eliminate that one as incorrect as well. And then the word enlarged means to make bigger or more extensive. So kind of the opposite of what occluded means. So D, C, and B are incorrect. A is indeed our best answer, the best synonym here, as we've seen as we've broken these words down. What is another word for transdermal? Is it A, subcutaneous? Is it B, intramuscular? Is it C, topical? Or is it D, oral? And the correct answer here is option C, the word topical. So these are all routes of administration for medication. And we're familiar with the word transdermal. We saw that a bit earlier on in the slideshow presentation. So remember that this word derives from the root word dermal, which refers to the skin, as well as the prefix trans, which means across. So when we're talking about a transdermal route of administration for medication, what we're saying is that we're administering medication through the skin. And this is often accomplished through, for example, patches, a transdermal patch, like a nicotine patch. You would put that on the skin and it would release whatever medication you're hoping to administer through the patch across the skin and into the body. Similarly, the word topical implies that a medication is applied to a specific place on the body, most commonly the skin. And there are all kinds of different topical medications, creams, foams, ointments, gels, to name a few. And so you can see how this word is very closely related to the word transdermal. They both imply the administration of a medication through the skin. What about our other routes of administration here? Subcutaneous. We mentioned that word a little bit earlier on in the presentation as well. So these are injections given just underneath the skin. Examples would include insulin and heparin. Intramuscular, these are injections given deep into the muscle. Many vaccines are administered intramuscularly. And then oral medications, as you are probably aware of, are means giving medications by mouth. So tablets, pills, liquids, again, many different forms of medications that can be given by the mouth. So the only one that is a synonym in some sense of the word transdermal is topical, and that's our correct answer. What is another word for syndrome? Is it A, a condition? Is it B, a disorder? Is it C, a sickness? Or is it D, an ailment? And the best answer here, the correct answer here, is option B, disorder, is another word for syndrome. So let's break down the word syndrome here. The root of this word, drome, means to run, and the prefix syn means together. So when we put those two together, to run together, a syndrome means a group of symptoms that consistently occurs together and thus characterizes a specific condition. So a cluster of symptoms indicating that a patient has a specific condition, disease, or even disorder. So one common disease state that you would hear the word syndrome associated with is AIDS, acquired immunodeficiency syndrome. Similarly, the word disorder is a set of symptoms or signs that define a particular issue. So again, talking about a cluster of signs or symptoms that indicate that a patient has a specific condition. For example, bipolar disorder or anxiety disorder would be examples that we could give. So you can see how those two words are very closely related. What about our other answer options here? The word condition means any state or situation, good or bad. So far too broad to be a synonym of syndrome. Similarly, the word sickness is too broad because this implies any state of being unwell, from a tiny cold to a very serious life-threatening cancer. So again, much too broad to be our correct answer. And finally, the word ailment indicates a minor illness. So the words disorder, the word syndrome, those carry a bit more of a serious connotation. Like we're actually going to diagnose you with something that you're going to be struggling with for an extended period of time, possibly the rest of your life. Ailment does not carry those same connotations. It's a very minor thing, like getting a little bit of a cold. So D, C, and A are incorrect, as we've seen, and option B is our best and correct answer. Which word means related to the ear? Is it A, auditory? Is it B, otic? Is it C, ocular? Or is it D, cardiac? And the best answer here is option B, the word otic. So otic derives from a root word that means ear, and the suffix ic, which we've said earlier in our presentation, means having characteristics of. So putting these together, this word literally does mean related to the ear. You would hear this word used, for example, if a patient has an ear infection. Sometimes they might get oral antibiotics to treat that ear infection, but sometimes they might be given otic solutions, so solutions that are actually administered through the ear to treat that infection. The word auditory is related to the ear as well, so it's referring to the same body part, but it is more referring to the function of the ear, as it means related to the sense of hearing, as opposed to the ear as a whole, like the word otic does. So similar to, but it does not have the same definition. Instead, it's referring to hearing. The word ocular refers to the eye, and the word cardiac refers to the heart, so different body parts entirely. So A, C, and D are incorrect. B is our best answer. Which word means a general feeling of discomfort, illness, or unease, often the first sign of an underlying medical condition? Is it A, malign? Is it B, malleable? Is it C, malaise? Or is it D, maltreat? And the best answer here is option C, the word malaise. And this is a word that we see associated a lot with the diagnosis of different conditions. It's often the first sign of illness. It's basically just that general sense of, oh, I feel like I'm getting sick. You know what I mean? Like you might feel that before you actually start showing other symptoms of sickness. Just the feeling that something is off. And when we break down that word, we really understand that it relates well to this meaning. So the prefix mal means bad, and the root word ase literally means ease. So they kind of are spelled similarly even. So putting those words together, this word literally means unease or ill at ease. And you can see how that really fits well with the definition that we're provided in our question. So the word malign has the same root, mal, as does the last word here, maltreat. So malign means to speak badly about someone or to be evil in nature or effect. The word maltreat means to treat cruelly or viciously badly. You might think that the word malleable also has that same root word, but it does not. It comes from a root meaning hammer, malleus. So this word means to be easily influenced or shaped as you would be if you were being hammered. So that's just an example of why vocabulary review is important, so that you are able to correctly identify prefixes and words that do not have the same prefix. So A, B, and D are incorrect. C is our best answer here. Again, that general feeling of, I feel like I'm getting sick. All right, which word means absolutely necessary or essential, crucial for life or well-being? Is it A, volatile? Is it B, variable? Is it C, vital? Or is it D, vague? And the correct answer here is option C, vital. So that word vital, it literally derives from a root word that means life. And so you can see how that root definition relates to the meaning that we're provided in this question. Absolutely necessary or essential, crucial for life. There's the meaning of our root word, or well-being. And an example in the medical context would be vital signs, things like respiratory rate, heart rate, blood pressure, temperature. These are signs that a person is doing well or not so well. And that's why we call them vital signs, signs of life, or signs of illness if they're not within that narrow range of normal. Our other answer options here, the word volatile means liable to change quickly or unpredictably, often for the worse. Variable means subject to change or fluctuation, but it's a little bit more neutral than the word volatile. And then the word vague means unclear, uncertain, ill-defined. So none of those three options really have anything to do with our provided definition. And again, the word vital is the best fit here, so that's our correct answer. Which word means dried out or dehydrated, typically used to describe something that has lost moisture? Is it A, saturated? Is it B, desiccated? Is it C, hydrated? Or is it D, moisturized? And the correct answer here is option B, desiccated, which is just kind of a gross sounding word, isn't it? So the word desiccated comes from a root word that means made thoroughly dry. So it's this idea that like all the moisture has been removed from something. You might hear people in the medical realm talking about desiccated skins, like that's skin that's very, very dry, which is not how skin is supposed to be, right? I mean, skin isn't supposed to be saturated with moisture, but it is supposed to be moisturized to some extent. So desiccated skin would be an issue. Something that might help you remember the definition of this word is the next time you go to the grocery store, if you go in the baking aisle, you might see desiccated coconut, which is coconut that has been completely dried out and you're able to use it for baking. And I don't know why, but sometimes like silly examples like that really help us remember things better. They help us retain things better than a traditional way of remembering it. So anyways, I like to throw those silly little things out when I can because sometimes they stick better than a typical definition of that word. So desiccated coconut, dried out coconut, or dehydrated coconut might help you remember the meaning of that word. What about our other answer options here? The word saturated means thoroughly soaked full of water. The word hydrated means to be well supplied with water. It can also mean to cause, to absorb moisture. And the word moisturize means to make something less dry, as you would if you were applying lotion to your hands to make them less dry. So all three of these other options are really describing the opposite of the definition that we've been provided with in our practice question. So desiccated truly is our best and most correct answer here. The only option that really makes sense here. All right, which word means to cough up and spit out phlegm or other substances from the throat or lungs, often as a result of respiratory irritation? Is it A, expeditious? Is it B, expectorate? Is it C, exacerbate? Or is it D, extricate? And the correct answer here is option B, the word expectorate. And this is kind of a fun one, I think. So the word expectorate, it comes from the prefix ex, which means out, and the root word pectus, which means breast or chest. So putting those two individual definitions together, this word literally means to expel something from the chest, which is what you would be doing if you were coughing something up and spitting it out of your throat or lungs, because where are the lungs located? They are located in your chest. So that definition correlates well with the one that we're provided in our practice question. What about our other answer options here? The word expeditious means to have something done with speed and efficiency. The word exacerbate means to make something worse. The root word there means harsh or bitter. And the word extricate means to get yourself out of constraint or difficulty. So D, C, and A, those definitions don't fit with what we're being asked about in this practice question. The best answer, again, is the word expectorate, as we've seen by breaking it down into its individual parts. So choose the opposite of this word, cartilage. Is it A, ligament? Is it B, tendon? Is it C, bone? Or is it D, muscle? And the correct answer is option C, the word bone. And by breaking down the word cartilage, we'll better understand why that is the case. So the word cartilage, it comes from a root word that means gristle, and it originally referred to firm elastic tissue. It might also possibly be related to another root word, which means wickerwork. And wickerwork is a type of pliable wood that is used to make furniture and other items, the key word there being pliable. So in our modern day usage of the word cartilage, it's a flexible connective tissue found throughout the body. For example, it's found in our joints, it's found in our larynx or voice box, it's found in the external part of our ear as well as our nose. And you can see that it's flexible if you kind of move your nose around or the outside of your ear. Like, it's easy to move those parts of our body because they're made of cartilage, which is, again, flexible, pliable. In contrast, bone is rigid mineralized tissue that makes up our skeletons. In other words, it is not flexible, and that's what makes it the opposite of cartilage. Ligaments are connective tissue that connect bone to bone. Tendons are connective tissue connecting muscle to bone. And muscle is fibrous tissue that produces movement. So all three of these other types of tissues have some kind of movement, some kind of flexibility even, but bones do not. And so again, that's what makes it an appropriate opposite of the word cartilage. And so bone is our correct answer. Select the correct spelling of the word. A, chronology, B, chronology, C, chronology, or D, chronology. And the correct spelling of the word chronology is option C. So the word chronology comes from a root word chronos, which means time, and a suffix, which we've seen before in our presentation, logi, which means the study of or interest in. So a chronology is a timeline or arranging events and or dates in the order of their occurrence. And this is important, for example, when we're trying to diagnose a patient or when we're trying to determine what's causing their symptoms. We would ask, like, what was your first symptom? When did it begin? How long did it last? And then what happened? So on and so forth, and put a chronology of their signs and symptoms together leading up to an appointment or a medical event in order to correctly diagnose them. So that's how we would use that in the medical realm. Chronologies are very important in understanding the progression of a patient's condition or disease. And again, option C is our correct spelling of that word. So select the correct spelling of this word. Is it A, diagnosis? Is it B, diagnosis? Is it C, diagnosis? Or is it D, diagnosis with two S's? The correct spelling of the word diagnosis is option C. So what is a diagnosis? Well, it comes from the root word gnosis, which means to recognize or know. And the prefix dia means apart. So putting these two definitions together, it gives us the idea of being able to distinguish or discern something, to tell it apart. So in medicine, making a diagnosis refers to the ability to recognize and identify an illness or other problem or condition by examining symptoms. So we examine the symptoms and we're correctly able to distinguish what is causing those symptoms. Again, very closely related to what we were talking about in our previous practice question about the word chronology. The order of symptoms, the order of events can help us make this correct diagnosis or correctly identifying what's causing a patient's symptoms. Select the correct spelling of this word: A, dysfunction, B, dysfunction, C, dysfunction, or D, dysfunction. And again, the correct answer is option C. That's the correct spelling of the word dysfunction. So when we break down the word dysfunction, what do we get? Well, the root word function means to perform. And the prefix dis means bad, abnormal, or difficult. So putting those two together in a medical context, a dysfunction would imply an abnormality or impairment in the normal operation or functioning of a specific body part, organ, or system. So something is not working as it should. An example of a dysfunction would be an erectile dysfunction. In an erectile dysfunction, a male is not able to achieve an erection as he typically would. So that part of his body is not working normally. And you can see how that relates to the broken down definition of the word dysfunction that we just provided. And again, option C is the correct spelling of this word. All right, select the correct spelling of the word dilate. Is it A, dilate? Is it B, dilate? Is it C, dilate? Or is it D, dilate? And the correct spelling of the word dilate is option C. So what does the word dilate mean? Well, when we break it down, the root word means wide, and the prefix di means apart. So to dilate something means to spread it out, to make or become wider, larger, or more open. And I can think of two examples in which we would dilate a body part. One would be when you're getting an eye exam. Sometimes when you go to the eye doctor, they'll dilate your pupils to get a better look at the inner structure and functioning of your eye. Also, prior to childbirth, a woman's cervix will dilate. It'll become larger and more open in order to accommodate the passing of a fetus. So you can see how those two examples correlate well with the definition that we have just provided of this word. And again, option C is the correct spelling of the word dilate. Select the correct spelling of the word acute. Is it A, acute? Is it B, acute? Is it C, acute? Or is it D, acute? The correct answer is option C. C is the correct spelling of the word acute. This word is interesting too. So the root word means a needle or sharpen. And in medicine, the word acute refers to symptoms or problems that are typically sudden, short-lived, and severe. So think about the pain that you would feel if you got poked with a needle or something sharp. It would be a very sudden pain. It's typically short-lived though. It doesn't last for a long time, but it can really hurt. It can be severe. So that's a good illustration of what this word means. And again, option C is the correct spelling of this word. All right, select the correct spelling of the word hospice. Is it A, hospice? Is it B, hospice? Is it C, hospice? Or is it D, hospice? And the correct spelling of the word hospice is option C. So hospice derives from a root word that means rest house or shelter. So this carries with it the connotation of hospitality, of making people comfortable. of helping them rest. So in medicine, hospice refers to a facility or a specific type of care that's focused on providing comfort specifically to those with terminal illnesses, or those who are at the end of their life. So it's associated with end-of-life care. It's also called end-of-life care. So typically in medicine, we're trying to cure diseases or at least prolong people's lives, but that focus shifts when we're moving into hospice care. What we're really going for with this type of care is dignity, rest, and comfort in a patient's final days. That might be months, that might be just a few days or weeks, but the focus of our treatment has shifted to providing rest and providing comfort. It's also sometimes called comfort care for that reason. And again, option C is the correct spelling of this word. Okay, so in our remaining time together, let's shift from talking about breaking down words into their respective parts to using context clues to help determine the meaning of unknown words. So when we're reading texts, it's very common to come across words that we don't know because there are tons and tons of words in the English language. And so not very many of us know all of them. So often we can use the context surrounding that word to help us understand what it means. So context refers to the other words in sentences that surround the unknown word. So let's look at an example sentence to illustrate what I mean by that. Lewis's teacher was offended because after she called on him, he gave a flippant response instead of a serious answer. So that underlined word flippant is going to be our unknown word here. And we're going to use the context clues in this sentence to figure out what it means. So here's what we know based on this sentence. 1, that the teacher was offended. 2, that Lewis gave a flippant response instead of a serious answer. So why are those clues that would help us figure out the meaning? Well, we know that Lewis said something that offended his teacher. She was upset with him. And another key word in this sentence is the word instead. It means that instead of a serious answer, Lewis gave the opposite of a serious answer. So based on those clues, the word flippant can mean lacking respect or seriousness. Context clues can also help us determine a particular definition of a word. Some words have multiple meanings depending on how they get used in a sentence. So context clues can help us avoid confusion by helping us understand which particular meaning of that word an author was intending. So we'll go through some practice questions in our remaining time here to help us understand how to use context to guess at the correct definition of an unknown word. So we're going to choose the meaning of the underlined word in the sentence. The patient's condition took a precipitous turn and his vital signs deteriorated rapidly. Does precipitous mean A, calm and stable? Does it mean B, abrupt and steep? Does it mean C, measured and gradual? Or does it mean D, unchanged and constant? So before we get into our correct answer, as well as our explanation of why that is the correct answer, let's look at the context of the sentence. So key words here would be deteriorated rapidly. So that is not something good, right? If we're having rapid deterioration, that indicates that's an ominous, that indicates seriousness, and seriousness in a bad way. And so looking at our answer options here, the only answer option that indicates something serious that could also be taken in a bad way would be option B, abrupt and steep. And when we break down the word precipitous and go through the definitions of abrupt and steep, we confirm that this is our correct answer. So precipitous comes from a root word, capit, which means head. You can see it there in the middle of this word. It also has the prefix pre, which means before. So taking these two definitions together, we have the connotation of someone falling headlong or headfirst into something. So this is something sudden and dramatic and bad, as we said, based on the context of the sentence. Similarly, the word abrupt means sudden and unexpected, while the word steep means falling sharply. So those fit well with the definition of precipitous, but they also fit well with the context of the sentence and the key words that we pointed out, deteriorated rapidly. So that makes option B our correct answer. And again, if we run through our other answer options here, calm and stable, measured and gradual, unchanged and constant, all of those are good things, or at least not as serious as the context that we're given. So B is our best answer. The patient's condition worsened due to the invasive procedure performed last week. Is it A, gentle and non-disruptive? Is it B, aggressive and intrusive? Is it C, superficial and non-threatening? Or is it D, temporary and fleeting? And before we say what the correct meaning of the word invasive is, let's again look at the context of the sentence that we're given. The key word here is that the patient's condition worsened, right? It got worse. There's a problem that needs to be addressed. So with that in mind, let's go back to our answer options here. And really the best answer option is option B. That's going to be our correct answer here. So let's break down the word invasive to confirm that we got the right answer. The word invasive comes from a root that means to go or walk, and the prefix in means in. So putting those together, the idea of the word invasive is to go into, to attack or invade. So more of a serious connotation there. In medicine, an invasive procedure is one in which instruments or objects are introduced into a patient's body. So we're putting things in that are not technically supposed to be there. They may be helpful things, but they're also not supposed to be there under normal conditions. So this is in contrast to non-invasive procedures where we would not be introducing items into a patient's body. So what about the words that make up our correct answer here? The word aggressive means ready to attack or confront, while the word intrusive means causing disruption. And you would certainly see those if you were introducing something into the body that's not technically supposed to be there. So they fit well with the definition of invasive, but they also fit well with the context of our sentence, which implies that the patient's condition worsened. So something bad is happening, something serious is happening. And that makes, those words make the most sense here. A, C, and D don't imply something serious or bad or something that needs to be addressed right away. And so they are not our correct answers. Option B is our correct answer, as we've seen. Okay, so choose the correct word to fill in the blank. After the surgery, the patient experienced a severe blank that required additional medical attention. Is it A, diagnosis? Is it B, procedure? Is it C, complication? Or is it D, medication? So let's look at the context of our sentence before we choose our correct answer. So key words given this sentence would include the word severe, and also the fact that this, whatever it is, required additional medical attention. So with those context clues in mind, looking at our answer options again, the correct answer is going to be option C, complication. So the word complication, it comes from a root word meaning to fold, and the prefix com means together. So the connotation is one of a folding together, a combining, an entangling, or an intertwining. So when we use this word in a medical context, a complication is a secondary disease or condition that aggravates an already existing one. So in our example sentence here, the patient's original condition was that they had a surgery. So a complication of that surgery that would be severe and that would require additional medical attention would be, for example, unexpected bleeding or an infection. Those would be complications, secondary diseases or conditions aggravating the one that was already existing, which is that the patient is recovering from a surgery. The word diagnosis, the word procedure, and the word medication don't fit well into the context of this sentence. The best answer is the word complication, as we have seen. So that is our correct answer. Before we wrap up this study session, don't forget that you can get everything you need to prepare for your upcoming HESI entrance exam with just one click. Get what you need to study to pass your exam and prep you for your program with videos, practice tests, a mobile app, and more at an affordable price. Get what you need to pass at www.smarteditionacademy.com. The doctor advised the patient to blank the medication with water to reduce its concentration. Is it A, fracture? Is it B, dilute? Is it C, hemorrhage? Or is it D, regimen? So what are the context clues in this sentence? That we are doing something to the medication with water, and that the purpose of that is to reduce its concentration. So with those clues in mind, looking at our answer options here, the best answer option and the correct one is option B, the word dilute. And when we break down that word, you'll see why that is. So this word comes from a root word meaning washed away or dissolved. So this means to make something thinner or weaker, which is what you would be doing if you were mixing a medication with water and trying to reduce its concentration. That makes something thinner or weaker, right? So this word correlates well with the context of our sentence. Our other answer options, fracture, hemorrhage, regimen, they don't really make sense given the context that we have seen. So B, dilute, is our correct answer here. The doctor discovered a blank tumor during the examination. Is it A, benign? Is it B, invasive? Is it C, symptomatic? Or is it D, unconscious? And the correct answer is option A, benign. So one thing that I wanted to point out with this practice question, and it's why I chose it, is that sometimes the context clues have to do with what is not present in a sentence as much as they have to do with what is present in a sentence. So keywords here would be that the doctor discovered. But we're also not given any indication in the sentence that what the doctor discovered was something serious, concerning, or bad, right? We just know that the doctor found it while he was doing his examination of the patient. So going through our answer options, you'll see why I mentioned that. The word benign comes from a root meaning well, as in good, and a suffix meaning born. So the idea is that something, if something is benign, it's something that's tolerated well, it's gentle on the body, it's kindly, it's not something that is harmful or concerning in any way. Which fits well, again, with the context of our sentence, because we're not told that anything serious or bad has been discovered. In contrast, the word invasive means something that tends to spread prolifically and undesirably, especially as it relates to tumors. So that would be something bad and serious and concerning. And again, we're not given anything in the sentence to indicate that that is the case. So B is incorrect. C is incorrect because if the patient were having symptoms, they would have come in and told the doctor that, and the doctor would have been aware of those before he started doing his examination. But we're not told that. We're told that the doctor discovered it, which implies that there were no symptoms that would tip the doctor off to the fact that the tumor was present before he began his examination. So C is also incorrect. And then D, the word unconscious, just really doesn't fit the context of the sentence talking about a tumor. Unconscious would refer more to the mind and to awareness than it would to a medical problem like a tumor. So D, C, and B are incorrect, and we're left with A, which is our correct answer. So again, just to reiterate, sometimes context is about what's present in a sentence. Sometimes it's also about what's not present in a sentence based on the answer options that are available to you. So keep that in mind. All right, choose the meaning of the underlined word in the sentence. The patient was experiencing severe gastrointestinal discomfort after consuming spicy food. Does gastrointestinal mean A, relating to the study of skin disorders, B, pertaining to the digestive system, C, associated with bone fractures, or D, concerning eye-related issues? And the key words in this sentence, our context clues here, are the fact that the person consumed spicy foods. So the system most closely associated with the food that we eat would be our digestive system. So option B is our correct answer. And when we break down the word gastrointestinal, we confirm that. So this word comes from two root words. Gastro means stomach or belly, while intestinal means intestine or gut. So this word does refer to the digestive system and specifically to the stomach and intestines, which would indeed be affected and subject to severe discomfort after consuming spicy foods, especially if you are not used to consuming spicy foods. Option A, option C, and option D refer to body parts that aren't really affected by the food that we eat, at least not directly. So those are incorrect. Option B, again, is our best answer here. The patient complained of chest pain and difficulty breathing, indicating a possible constriction of the airway. What does the word constriction mean? Is it A, relaxation? Is it B, narrowing? Is it C, expansion? Or is it D, relief? And keywords here that give us clues as to the definition of the word constriction are chest pain, the fact that the patient is complaining, and then difficulty breathing. So those mean that something serious is happening, something bad, something that needs to be addressed medically. And the only answer option out of our options here that make sense in the context of the sentence is option B, narrowing, a narrowing of the airway. And if we break down the word constriction, that confirms that this is our correct answer. So the word constriction comes from a root word meaning to draw tightly, and the prefix con means with or together. So you can think of like a drawstring bag being open, and then when you pull on the strings on either side, the opening of that bag is drawn tightly together and closed off. It's narrowed. So this word indicates a binding or drawing together to tie tightly together. So we use the word constriction when we're talking about the airway. We could also use it when we're talking about blood vessels. So again, the idea of something being wide and then being closed off, drawn tightly together. And this would indeed cause the symptoms that the patient is complaining of, the chest pain and the difficulty breathing. So that makes sense as our correct answer. The other words that were given here, relaxation, expansion, relief, those would all indicate the alleviation of the patient's symptoms. So what would happen after we treated the patient medically and stopped the constriction in their airway. So they don't fit well with the context of the sentence and are thus incorrect, A, C, and D. The best and correct answer is option B, narrowing. So that is our right answer here. All right, final question here. The doctor wrote a prescription for antibiotics to treat the patient's infection. What does the word prescription mean? Is it A, a prediction of the patient's future health status? Is it B, a set of guidelines for maintaining a healthy lifestyle? Is it C, an order for a specific medication to be dispensed by a pharmacist? Or is it D, a detailed medical history of the patient's previous illnesses? And the correct answer here is option C. That defines the word prescription really well. And when we break down this word, we'll see why that is the best answer. But first, let's look at the context of our sentence. Key words are that the doctor wrote, and he wrote 4 antibiotics to treat. So the word prescription comes from a root word meaning to write. That's the word script there in the middle of this compound word. And the prefix pre meaning before. So this is writing that occurs before something else. It can also mean to direct in writing. So think about prescription versus non-prescription medications. For non-prescription medication, also known as over-the-counter medication, you can just walk into a store like Walmart or CVS and you can buy these medications without having seen a doctor beforehand. But for medications that require a prescription, you have to go to the doctor before you are able to get these medications. Why? So that the doctor can write down an order that you can then take to the pharmacy and give to the pharmacist that allows them to dispense that medication. So the writing of the prescription occurs before the dispensing of the medication or treatment. So you can see how that correlates with our definition. You can also see how that fits the context of our sentence. And that makes option C our correct answer. A, B, and D are referring to other words. A is referring to a prognosis. B is referring to a regimen, while D is describing a medical history, a history and physical, for example. So C is the only answer that makes sense here, and we've seen why. All right, that concludes our presentation on vocabulary acquisition and medical terminology. I hope that that was helpful to you. I hope you feel more confident now in being able to break down words, being able to use context clues to help you determine the meaning of words that you don't know in sentences. Those are going to be valuable tools for you as you take your exams when you don't have an opportunity to stop and look up words that you don't know. So for some of you, the best way to learn medical terminology is just to memorize a ton of words. But I find that for most people that does not lead to retention. One thing that I would like to suggest instead is that you weave your learning of medical terminology into your study of your other subjects. So maybe have a notebook that you always have on hand that you can write new words in, and also like the prefixes, root words, and suffixes that make up those words. Especially anatomy and physiology, I think you'll find this helpful. So as you're studying the different body systems in anatomy and physiology, you'll encounter many of these medical terminology words that we've covered, and new ones as well. So for example, like you're studying the integumentary system, you're studying the skin, and you learn that the skin is made up of 3 layers: the epidermis, the dermis, and the hypodermis. So all 3 of those words have the same root word, but 2 of them have added prefixes which give an indication of where they are located in the order of the skin layers. And learning those prefixes can help you as you move on to other symptoms and you encounter them in other parts of the body. So by stopping in your study of the integumentary system and breaking down those words, you're also learning medical terminology that will then help you as you go on to study other parts of the body. So I would make it more of an organic study. I think that will help you retain these terms better, because learning them in context as opposed to just memorizing a big list of words might help you just remember better by association with different parts of the body, different structures, different systems, things like that. So that is one suggestion, just as you try to learn medical terminology, to put in the time and effort to stop and look up words as you encounter them in your studies. Again, if you need further review on these topics, we have several lessons on the Smart Edition website that walk through the concepts that we've walked through today. Those are also available on the Smart Edition website, so feel free to take advantage of those resources as well. Thank you again for joining me. Have a wonderful rest of your day.